Welcome to Healthy Conversations with Athens-Limestone Hospital, where we bring expert insights to help you and your family live healthier lives. I'm Susan Claiborne, joined by Jordan Oles, as we talk with Mark, our Executive Director of Operations and Hospital Safety Officer, along with Cheryl, Education Coordinator. Their work ensures that safety is at the heart of everything we do, not just in medical care, but in creating an environment where patients, families, and staff feel protected. From preventing hazards to preparing for emergencies, and even taking a stand against violence toward healthcare workers, the entire team works tirelessly to keep our community safe. So thank you both very much for being here. And so kind of as we get started, Mark, kind of tell us about your role as the hospital safety officer, and then kind of when you finish, if Cheryl, you'll kind of add into that, kind of how you play a role with that.
Okay. So my role touches a lot of different areas within the support service world. And when I say support service in healthcare, I mean we support those who, on the clinical side, who provide the care to the patient. And, if they don't feel safe and secure, then, that hinders their ability to provide that care. So, another part of my responsibility is following guidelines set by organizations such as OSHA, the NFPA, the Joint Commission, also responsible for setting policies and procedures related to safety. So things like fire safety, utility safety, hazardous materials and waste, things like that. Also responsible for making sure we have the plans in place for emergency preparedness, things like disasters, workplace violence events, and things like that. So being the hospital safety officer, means having the safeguards in place so that anyone entering our facilities, whether it be staff, visitors, patients, feel safe and secure while they're there.
Okay.
As education coordinator, I teach several of the classes that start from new employee orientation their very first day, where we start talking about several of these policies and our plans and how we have our drills. To the new employees who are just getting their feet wet, we start that within the first hour of conversation with them. And then second day, go into our classes that are about helping manage aggressive behavior and helping de-escalate situations. So they're getting that from the very beginning about the safety. Because like Mark said, if we're, as employees, are not safe, our building's not safe, parking lots, we can't safely take care of everyone else.
Yeah, and I think we take for granted that the hospital is just always ready for an emergency or always ready for those things that come up. But there's a lot of planning and things that kind of have to take place in the background, and a lot of drills that we do that to keep us prepared for that. And I know as an employee, I've attended some of those classes, and I know we have annual online classes that we continue to educate and get updated on ways to keep ourselves safe, the patients safe, how to handle.
We try to keep it fresh in your mind.
Yeah,
Because you get busy in your everyday task and it's
Yeah.
like, oh wait, I remember something about that.
Yeah, and how to
Keep
be
it fresh.
prepared for those experiences that we hope never happen at the hospital, but you need to be prepared for. Yeah, okay. So is this something you kinda always wanted to do, or kinda how'd you end up in hospital safety?
Yeah, so safety has always been in my background, in my career since the start. In high school, my first job was working at a marina and had several aspects of that job related to safety, taking care of boats, storing them safely, putting gas in them safely, maintaining the grounds and premises safely. When I was in college, I actually worked at Talladega Speedway on the fire and safety crew. And so pretty cool job. When there was wrecks out on the track, our job was to go out there, clean it up, take care of all the oil spills, things like that, make sure the track was ready to go in a safe and timely manner. Also in college, I worked for a racing school. I was a racing instructor, so it was my job to either give people rides in the race car, and obviously there's a lot of safety aspects that go into that, or riding shotgun to the people who paid to drive the cars and instructing them on what to do. So yeah, a lot went into that. Those were fun jobs. When I graduated college and time to find a big boy job, my grandparents at the time were kind of declining in health, getting on up there in age. They were in facilities, and not to say anything bad about the facilities they were in, but when I went to visit them, I just saw a need my passion for safety and to make that world a better place. And so around that same time also, my brother passed away from an infection, hospital-acquired infection. So safety has always just kind of pulled me to it, and I saw a need and wanted to make the healthcare environment a better and safer place.
Hmm. We could just about cut right here, and I've already learned a lot.
And so you spoke about, infection and whatnot. And so, most people think that in the healthcare setting that it's all about patient care or infection control, safety measures. But give us, some insight on some other areas that you oversee as far as safety is concerned.
Yeah, and those two things are so important: patient care and infection control. And again, we have to provide the support to the ones providing the patient care and the ones trying to keep infection rates low. So some of the other areas that I oversee, plant operations, that's the mechanical and facility side of things, maintaining things like generators, chillers, fire alarm systems, sprinkler systems. Cheryl mentioned parking lots. That's things that people don't take into consideration. We have to keep these areas safe and secure so that our staff and visitors will feel safe and secure also. EVS, which Jordan directly oversees, one thing we have to look at is chemicals and chemical exposure limits. That's something people don't think about. Chemicals like formaldehyde and glutathione, to make sure that we have companies come in to make sure that we're not exceeding those limits.
And with the EVS standpoint of that too, we also do some testing. Mark's familiar with in the rooms. We call it ATP testing with a luminometer, and what we do is we go in and test surfaces in those individual rooms to see if they're disinfected properly, to make sure they're clean. The next patient's coming in. We know that our chemicals that we use for cleaning are doing what they're supposed to be doing. So just one of the things that I assist him with in his roles though. So another thing, Mark, what are some statistics, local or national statistics that you may know regarding, what how safety measures are important for us? What do you see, either on a local or national basis? What do you see that makes it so important for us to be ahead of the curve with safety and security?
Yeah, that's so important to prepare and to plan for and to look at the stats. And I'll share some stats, for us as a hospital. Just in last year in 2024, we had 38 employee injuries. That might seem like a lot. It might not seem like a lot to some people, but it's 38 too many to me. And that could happen for a different variety of different things. Back injuries, workplace violence, assaults, falls, needle sticks, lifting injuries, things like that. And then, to tack on some more stats, workplace violence events that security was actually called to, 76 in 2024. So, unfortunately, workplace violence is on the rise, and we're constantly, meeting to try to combat those issues. And then, related to emergency management, we actually had two real events in 2024. One being the winter weather event where we had a lot of snow and ice, and basically the hospital, we weren't on lockdown, but travel and things like that were there was a challenge. And we also had the water loss. So the city had a water loss issue, and so this was in the middle of the summer, 100-degree day, and had to go several hours without water. So these are all things that we have to take into consideration and plan for.
Yeah.
And most people don't, realize the preparedness that goes into such as a winter weather event, all the things that you have to have in place or on campus to make it through until a vendor or whatnot can get back to you to deliver or provide whatever that service may be. So, I feel like the hospital does a very good job at being prepared for these types of events. So,
Backtrack one, excuse me, backtrack 1 second for what Mark said with statistics. OSHA being over multitude of companies, industries, their statistics are over 70% of their injuries, reportable injuries, are healthcare violence. And that's from oil rigs to construction to every company, industry type that they're over. Majority, nearly 3/4 of their reports are healthcare violence.
Yeah, I mean, we've definitely had a larger push on that. I know from the 2 of you at the hospital over the last, few years specifically, and I know we've got some signage that has gone up just within this last year and stuff to basically kinda tell the community, like, "This is serious, and we take this really serious." So, um so what are some common, environmental hazards that the hospital has to guard against, and kind of how do we prevent them, or potential
Yeah.
hazards that become problems.
There's so many hazards. I could talk about this for hours, but to highlight, some of the more common ones that we see a lot of. I've already mentioned chemical safety, but chemicals, that's huge. We have to make sure that they're labeled appropriately, labeled to let staff know what it is, what hazards are in it, the proper storage of chemicals. Some chemicals have to be stored by temperature. Some have to be stored in a secure place so that children or whoever might be in the hospital can't get to them. And then disposal of the chemicals. And so we know how to dispose of them by the SDS or the safety data sheets that we keep on hand. Another one being needle safety, making sure that they go in the sharps containers that we have mounted on the walls in a lockbox so that not anyone can just take them. Making sure they have the appropriate lids where nobody can just stick their hands down in them. And then the proper disposal of those also, making sure that they go to the appropriate location, and then we have a company that comes in and, safely takes those away. And another one I'll talk about is bloodborne pathogens, and that comes down to the cleaning of the rooms and making sure that, it's cleaned appropriately according to the proper chemicals and the proper disinfectant times, kill times, wet times, and then making sure that the appropriate waste goes in the appropriate waste stream, whether it be mainstream trash, regular waste, or the biohazardous waste, which would be, anything saturated with blood or bodily fluids, anything like that.
Another thing is people may not think oxygen tanks, for example. Oxygen tanks, from whether they're full, partial, or empty, have certain ways that we have to store them. Joint Commission will come and look. Fire extinguishers, your regular red fire extinguisher, like you'll see all over our walls, like you hope have at home, can't be used in certain areas, like not in the MRI area. There's special ones for kitchen
Yeah,
diesel,
kitchen and
kitchen
yeah.
and helipad and
Mhm.
the MRI room. So there's specifics that break down even more that you have to think about.
Yeah, we've kinda talked about in other episodes, how really kinda deep and complex the hospital is and what all it takes to kinda go into it, and I had an incident last night that just was kinda one of those, "Oh, yeah," kinda instances. I'm trying to just get ready for a health fair, just trying to gather all the supplies for a health fair, and I just happened to be talking to my daughter about, getting this, and she's like, "Well, do you have this? Do you have this? Do you have this?" And then she says, "Do you have a sharp container?" And I went, "Oh god, no, that's the one thing I didn't grab was a sharp container?" So you just don't think about all the things that it takes to prep for every single thing that we do, and like you said, each department has its own set of environmental hazards, the ER to the ICU to the standard patient room to the kitchen, so, it definitely is. So we've talked about some of the little complex, so at least let's take a high moment here to kinda talk about maybe some of the, improvements or updates, that you're kind of especially proud of?
Yeah, absolutely. They're proud of a lot, but if I was going to highlight something right now, it'd probably be our workplace violence prevention team. We have a we have a great team in place. We have a workplace violence committee that meets quarterly and discusses ways to improve our workplace violence. And some of the things that we've been working on in the last couple of years and recently is additional security. We've added additional security throughout the hospital. A couple of years ago, we had one security officer on site at all times. Now sometimes we have up to three on site at all times. So that's been helpful. Signage, like you mentioned earlier, increasing our signage, making everyone aware at our entrances and things like that. Additional cameras, badge readers, panic alarms. We've added a lot, so we have most of the hospital covered now. It brings that safety awareness to our staff. We just recently implemented what we call the flagging of aggressive patients, and if we have anybody, it doesn't have to be a patient, come in and they're aggressive, we can potentially flag that person, or if it was a patient, flag them in their chart. And the next time they come back, it alerts our staff, hey, this patient has been violent or aggressive in the past. And then they notify the other staff and they'll call security. And then we also have magnets that we can place at the door of wherever they're at within the hospital. And that also alerts staff that, hey, this patient has been aggressive before.
And I talked to staff about with that flagging, it doesn't mean we're not taking care of them. But maybe before I need to go in the room, I check at the desk and say, hey, has everything been okay? Because they may have just spent 30 minutes getting them settled down. Or if two of us need to go do something, let's go in together. So there's two of us. It's less interruptions in the room. There's two of us as a safety factor. So that magnet doesn't mean, oh, they're not going to take care of me or they don't care. It just means we're watching safely to take care of you.
Yeah, and I think some people may think that when we say something about aggressive behavior that it's a problem patient, but you can see aggressive behavior in an older patient with Alzheimer's that
Absolutely.
just doesn't quite understand and is confused and upset and things like that, and it can get aggressive very quickly.
And two of us going in there to take care of them was, if I need to do vital signs, maybe you should walk in and you should hold their hand and talk to them while I'm doing that. So it's a safety and they get less agitated, hopefully, with that.
Yeah. Well, and I think we have a class that I think we've had some great numbers, like all employees. Kind of, I think we reached what about not in the 90 percentile of employees.
We were at 100% for those that are not in still probationary period.
Awesome, and that's a Moab class. I remember because it's training on kind of how to handle those
Moab,
situations.
management of aggressive behavior.
Yeah.
So, yeah.
Yeah.
And the goal is to de-escalate the
Right.
situation, recognize it quickly, start de-escalating, and if it doesn't de-escalate, different steps that you can take with that.
Yeah.
So while we're touching on the topic of, aggressive patients and whatnot, it's a sad situation that we know some of our workers do experience verbal or physical violence from patients or even visitors or whatnot. So what do we do? What does the hospital do to handle those types of situations? Are there any, legal aspects that we have in place that kind of assist our staff with, navigating those issues?
Yeah, so unfortunately, it does happen far too often, but it's a team effort. Not one person can do it all on their own, and you need to see it happening, recognize that someone is becoming aggressive, and then see the need to ask for help, whether it be from a coworker or from security or from someone from administration, things like that, and then. You just touched on Moab, but always, perform the de-escalation techniques. We don't want to escalate anything. We want to de-escalate the situation. And as far as the legal aspect, our staff can press charges if they want to.
It's a felony in Alabama to assault a healthcare worker. So those charges can be pressed. It is up to the individual employee if they want to pursue that. Because some don't, depending on the situation, and others, there's various reasons why they might not, but others do.
Yeah. And, it's good to know, shout out to our local law enforcement that we do have the backing from them that will stand their ground and press charges if needed.
Yeah. Well, I have family members that work, bedside care and things, and I know I've heard the stories, and you hate that it happens, but it does, and so I'm so glad that we spend some time focusing on that. And I think it's important that the public understand, that these things have serious consequences in the hospital, and that's the reason we have that signage. So can't say they didn't know when they came in that we take that extremely serious.
It is posted all around the hospital that we will not accept it. I mean, we mean it. So,
well, we love our staff and we want them to stay, and you've got to provide that safe work environment, which I know that y'all both feel very passionate about being able to do. So kind of away from the workplace violence kind of stuff. What about some things like natural disasters preparedness? I mean, how do we prepare for things like that?
We would like to stop all tornadoes if that was possible. That would help considerably.
It would. In the area we're in, it would, wouldn't it? And I know that we get like notices on our phone for staff. I know that we kind of receive that, so we kind of have an idea of what we've got to prepare for, kind of what's it called? It goes into effect. I know I received the
Everbridge. We get the Everbridge.
Yeah, right,
Yeah.
right.
And the code green, and
Right.
whatever it may be.
yeah, and we receive that.
Inclement weather,
yeah.
lockdowns, different code red, stay away, different things go across their text messages.
So what does it look like for training of staff, looks like when they're kind of preparing, comes to emergency drills or disaster response?
Yeah, so it all starts with our emergency operations plan. That's basically our plan and preparedness for all these different events and the emergency management team meets and we discuss this, we update it as needed. And it's available to staff on our internal system for them to see anytime they need to. So we perform 3 to 4 drills per year. Our emergency management team meets to discuss these drills, kind of decide what kind of drills we want to do. We try to change it up from year to year. Um, anything from severe weather to mass casualty to
Meth
de-
lab.
yeah, decontamination. Yeah, we just did a meth lab drill not too long ago. Cybersecurity, that's on the rise, so we got to be prepared for cybersecurity events. I mentioned water loss. Sometimes we had those drills or power outages, things like that. And these drills are, planned in coordination sometimes with our local EMA, our local police department, fire department, 911 center, things like that. So after we complete the drill, then we complete what's called a critique, and it kind of lists what went well, what went bad, and then we create an action log for the things that didn't go so well to let staff know what we're working on to make it better.
Well, like I said about stuff being complex at the hospital, I mean, even that is because it's not like you're working with the same group of people who are there Monday through Friday during the day, because these things happen at night with that group of staff. They happen on the weekend with that group of staff. So,
Right, exactly.
um,
Well, the cool thing what Mark was able to do this last year was we had an active shooter, but we actually had an open wing of the hospital that we actually had a real time. Gunfire and everything.
we had a drill.
There's a drill. Yeah, where's the drill? I'm sorry.
Yeah.
The active
There's a
shooter
plan.
drill.
Blanks.
Plan drill, shot blanks. And it was a real time, how you would respond. And that really gives you the actual adrenaline rush that you would get if you actually heard a live round go off, and how are you going to respond to that? And so it was a neat experience. Being one that was involved in it, was a pretty neat experience to
We
do
got strong
that.
feedback from
And some
staff.
very, very good feedback from staff. They really enjoyed being able to get the real time, how they would, you hear it and you respond to it, and what you would do in that situation. That was very interesting.
I'm glad you brought that up because, that is something we started about, 3 years ago, active shooter drills. And, unfortunately, it's a real thing. It happens. So we got to be prepared for it.
Your kids are testing for it in school and drilling for it. We need to also.
We do. And you can sit in a class and listen, and you can watch a video on what you're supposed to do. But like you said, until that adrenaline kicks in and you're truly responsible for those people around you and taking care of yourself too, knowing how you're going to respond.
Staff was interesting with that. They knew what to expect from the standpoint of they were aware ahead of time there was going to be live gunfire sound. And so they went into it knowing, and we said some in rooms, some at the desk, some in hallways, and to watch the reaction for whether they froze, jumped 5 foot in the air, ran into a room, started barricading, hid and couldn't be found because police then cleared the area. And then we started over. So it was.
And it was live. Like
It was.
They didn't
Yeah.
3, 2, 1 count it down. It just happened.
It just happened.
And you just went.
Yeah. It was definitely interesting to see some of the reactions.
Yeah, I had an incident years and years ago, and it ended up not being what I thought it was, but my body thought it was a specific thing, and I froze. And afterwards I'm thinking, okay,
Worst choice.
that's me. I'm just gonna freeze. So, kind of as we start kind of closing this out, because I know this has been a lot of information, but kind of what role can our patients and families and visitors play in helping keep our hospital safe?
Yeah, their involvement is so important, and it can help in preventing errors, improving communication, and supporting what we do. And speak up and communicate. Communication is key. And if you don't feel comfortable notifying the person taking care of you, reach out to their supervisor, or reach out to security, or reach out to someone in administration, and we'll do what we can to make sure that you feel safe.
I had a family member recently that was in another hospital. It was a different situation, another hospital, and transport came and they took the wrong person, and they realized it, came back to take the family member. And the family member's first statement to him was, "Did you not check the armband?" I thought, well, there you go.
Valid question.
Speak up.
Absolutely.
Speak up. So, well, I know that we're creating a culture of safety, between our staff and our community. But if you were, in closing with that, if you were to share kind of one key safety message with our community, what would it be?
Our mission is to be the difference. Our vision is excellence always, and safety, which we've been talking about, is one of our core values. So, we prepare and plan with that mission, vision, and value in everything that we do. So, I ask that the community keep supporting us, keep instilling their trust with us, and we're going to do everything we can to make sure that anyone entering our facility, from staff to visitors to patients to vendors to everyone, that we've got good plans in place, and that we're trying our best to take care of you.
Yeah.
So
Thank you. And would you like to add anything, Cheryl, as we close?
I'd ask to be aware in their own homes. It'll decrease your need in some cases to come see us and be prepared for those, we like to call them the what if situations. When we write drills and we write scenarios of the looking at things in the community, elsewise society, what are things that could give us those problems? So to have that mindset of be aware and then get prepared for that before they happen.
Yeah. Well, I appreciate y'all being here. You have any further questions?
No, I think y'all do a wonderful job.
Okay. Well, thank y'all so much. And part of, having these conversations is so the community can learn a lot about the backside of the hospital, kind of besides what we do and kind of how they're involved with that. So I appreciate y'all coming on and sharing about our safety of the hospital.
thank you for having us.
Thank you. Thank you so much for joining us and giving our listeners a behind the scenes look at how Athens-Limestone Hospital prioritizes safety for patients, families, and staff. To our listeners, remember, safety is everyone's responsibility. Whether you're a patient, visitor, or team member, small actions can make a big difference in keeping our hospital a secure and healing environment. Thank you for tuning in to Healthy Conversations. Don't forget to subscribe so you never miss an episode. And as always, let's be the difference together.